Hi everyone, we're talking a little bit more about fractures and stress reactions, and a lot of us would be seeing sort of metatarsal stress reactions, so I've chosen to focus on that today. And we're going to talk a little bit about patient positioning and then discuss the protocols that I use in clinic to try and get these patients back on their feet a little bit quicker. For us, it means that this is something that is longer duration, and we do know that PBMT will increase the healing, decrease the pain, and get our patients moving quicker. And so I just find it's a fantastic adjunct to, what I'm already doing. We see it post-surgically as well, and sort of start thinking about those patients that have maybe had a bone surgery, and we can potentially increase that healing a lot quicker. For me, patients are seated, and that's high enough for me to be able to be comfortable when I'm doing any treatment. If you've got a handheld device, definitely much more important here as well. But for me, over those metatarsals that are painful, I am going to be doing a lot of anti-edema or an anti-swelling sort of setting, and then a biostimulation or healing setting to make sure that I'm getting increased blood flow to increase that healing. Now, if this is a patient that has recently undertaken an osseous procedure, like a bone or a bunion procedure, then I might not be going as aggressive in that early stage, utilising the anti-edema. I will mainly just use biostimulation initially, because what I've found with the anti-edema is that it really interrupts that initial inflammatory phase, where we potentially are getting too efficient and not allowing that osteoblastic action to take effect as we do need in that first week or two post, say, hallux valgus correction. And so I'll just increase the blood flow to the area to make it more efficient, not necessarily take away all the good inflammation that we do want there during an initial event. But when I'm typically seeing stress reactions, I am going to go pretty heavy, and people tend to really respond to that quite effectively. Let's take a look at what that is. In the case of the MLS M8, I'm really going broad around those lesser metatarsals to make sure that I get a really good outcome. This is our anti-edema setting initially, and then what we'll be doing is then building out from there with the biostimulation, like I said, to increase blood flow and healing. We can see that now that's just gone on to make sure that our patients really get a good outcome. And this may be, your typical runner, and, earlier in the year, particularly after our New Year resolutions have kicked in, this is what we're going to be seeing, or at the start of the new sporting season. So just keeping your eyes out for where this may be able to help decrease some of that pain. These are the protocols that I use, and I find that they're fantastic for patients that are able to get in and undertake these twice weekly. I just think it's a really good option to increase that healing. Patients' pain, may be more broadly associated with different things happening. It might be that they've got a really tight calf, which is causing some of that, forefoot overload. And so do consider whether you need to do some trigger points and, reduction of any contraction concerns through the calf muscle as well. But that should give you a little bit of an idea there. So reduce the edema, heal the bone, look at the biomechanics, and make sure you're putting that patient in a really good longer term position. But this has been fractures of stress reactions, the less metatarsal stress reaction being our example here, and hopefully we'll be able to see you in the next session. Cheers.